Vegetable oils and fast foods, frequent use of painkillers such as acetaminophen or ibuprofen, viruses that lead to liver damage and hepatitis, among other factors. And the list goes on and on. If you want to check for liver problems, watch this video till the end. We will look at 12 things that signal damage to your liver to detoxify it and stop further damage. First symptom: constipation, diarrhea, and intestinal bleeding. The liver is an organ with many important functions. One of these functions is to produce and secrete bile. Bile is a fluid that helps digest fats. If the flow of bile is disturbed, this can cause constipation. The liver is also responsible for removing toxins and waste products from the blood. If this function is impaired, this can cause diarrhea. Liver damage can also lead to blood clotting problems. This can cause intestinal bleeding. Constipation, diarrhea, and intestinal bleeding can be signs of liver disease, but do not always mean this. Second symptom: abdominal pain. If the liver itself becomes inflamed or damaged, this can cause pain. This can be caused by a number of conditions, such as hepatitis, cirrhosis, or liver cancer. If there is a tumor in the liver, this can also cause pain. As the tumor grows, it is possible for the liver to put pressure on other organs or tissues. If the gallbladder is in the liver and there are gallstones, this can also cause abdominal pain. Gallstones can block the flow of bile, causing pain, nausea, and vomiting. If there is a blood clot in the liver, this can also cause pain. This condition is called hepatic vein thrombosis and can be life-threatening. This pain usually occurs in the area where the liver is located, in the upper right quadrant of the chest. When the liver is not working properly, there may be tenderness or pain in this area. Third symptom: increased skin itching, is a symptom that can occur for many different reasons. Sometimes it can be caused by something as simple as dry skin or allergies. However, if the itching is severe or persists for a long time, it can be a sign of liver disease. Another function of the liver is to produce and secrete bile. Bile is a fluid that helps digest fats. If the flow of bile is disturbed, bile buildup can cause itchy skin. Your skin may become hypersensitive to touch. It may itch and rashes may occur. You may also notice that the veins on your body become more prominent, and you may often see bruises. The skin sensitivity and itching will probably not get better unless the problem in the liver is correctly identified and treated. Fourth symptom: edema. Edema is a condition caused by fluid accumulation in the body and can occur anywhere in the body, but is most common in the feet, ankles, and legs. Edema can have many different causes, but one of the most common causes is liver disease. Proteins help prevent the blood from leaking fluid from the vessels into the tissues. If the liver cannot produce enough protein, this can cause fluid leakage and edema. One of the first symptoms, especially in the feet and ankles. Lymphatic disease, heart failure, and hormonal imbalance are some of the causes of edema. Fifth symptom: changes in the abdomen. In liver injury, there may be major changes in the abdominal area, which can be listed as follows. 1. Abdominal pain. One of the most common symptoms of liver damage is abdominal pain. The pain is usually felt in the upper right abdomen, but can spread throughout the abdomen. The pain can be caused by enlargement or inflammation of the liver. 2. Abdominal swelling. Liver damage can cause fluid to build up in the abdomen. This can lead to abdominal bloating and tightness. 3. A palpable mass in the abdomen. Liver damage can cause the liver to enlarge or form a mass. This can cause a palpable mass in the abdomen. If you feel cramps or pain in your lower abdomen, this may be due to water retention in the abdomen or liver damage. One of the earliest symptoms of liver damage is fluid in the abdominal cavity. The sixth symptom is jaundice. Yellowing of your fingertips, tongue, and skin are symptoms that indicate jaundice. This disease usually occurs when bilirubin increases in body tissue and in the bloodstream. It is caused by the accumulation of a substance called bilirubin in the blood. Bilirubin is a substance produced from the breakdown of red blood cells. A healthy liver processes bilirubin and removes it from the body. When the liver is damaged, it cannot process and remove bilirubin, causing it to build up in the blood. Seventh symptom is a change in stool color. It can vary depending on the food you eat and how well your digestive system is working. However, some changes in stool color can be a sign of liver damage. The stool may be light-colored or clay-colored. This can be caused by a reduced flow of bile. Bile is a fluid that helps digest fats. Liver damage can affect the production or excretion of bile, and the stool may be black or dark brown. This may indicate a problem such as gastrointestinal bleeding or hemolysis, breakdown of red blood cells. Stool discoloration is caused by the liver not secreting enough bile. The stool color may be gray, clay-colored, or pale yellow instead of the normal healthy brown. Occasional changes in stool color are normal, but if they occur frequently, they are considered abnormal. Eighth symptom. Changes in urine color is affected by the food you eat, the medicines you take, and how much fluid you drink. However, some changes in urine color can be a sign of liver damage. Urine may be dark amber or brown in color. This can be caused by bilirubin accumulating in the blood. If liver damage cannot process and remove bilirubin, it can build up in the blood and darken the color of the urine. The urine may be light yellow or pale in color, which can be a sign of urine diluted with water. It can cause fluid retention, which can cause the urine to become less concentrated and lighter in color. A change in urine color is very likely to be a sign of kidney damage. If you drink enough water and your urine is still a dark orange color, this is potentially due to a decrease in bilirubin in the bloodstream. Ninth symptom, digestive problems. The liver is an important organ of the digestive system and has many important functions in digestion. When the liver is damaged, it may not be able to perform these functions properly, which can lead to digestive problems. One reason why the liver is such an important organ is that it supports bile, which helps digest food. If the liver fails, indigestion and diarrhea can increase. Gallstones, constipation, abdominal swelling, alcohol intolerance, intolerance to fatty foods, and irritable bowel all occur when bile is not produced properly. 10th symptom, loss of appetite. Other complications caused by liver damage include nausea and vomiting, liver failure, and toxin accumulation. Liver damage can often lead to fluid accumulation in the body, edema, abdominal bloating, and digestive system problems. These conditions can also contribute to loss of appetite. Liver damage can reduce the body's ability to clear toxins. In this case, the accumulation of toxins can cause a general feeling of weakness in the body and loss of appetite. For these reasons, there is often an association between liver damage and loss of appetite. However, it is important to note that not all cases of loss of appetite may be associated with liver damage. 11th symptom, general weakness and fatigue. In some cases, liver diseases can cause anemia. Anemia reduces the body's capacity to carry oxygen, which can lead to tissues not receiving enough oxygen and increased fatigue. The liver cleanses the body of toxins. However, in the case of liver damage, this clearing process can be affected and toxins can accumulate in the body. This can lead to a general feeling of weakness and fatigue. Feeling tired and weak all the time is one of the most common signs of liver damage. When the liver is not healthy, the body has to work harder than necessary and the need for rest increases at the same rate. 12th symptom, nausea. The liver is an organ responsible for bile production in the body. However, liver damage can negatively affect the flow of bile and impair digestive processes. Reduced bile flow can lead to digestive problems, especially symptoms such as nausea. In the case of liver damage, it can become difficult to clear toxins from the body. In this case, the buildup of toxins can cause discomfort and nausea. Liver failure can be a serious consequence of liver damage. It can affect digestive processes, increasing digestive problems such as nausea. Also, people with liver damage may have to take certain medicines, but some medicines can put extra stress on the liver and cause side effects such as nausea. This relationship is very important, not only for health, but also for understanding the complex workings of our body. However, not every case of nausea is associated with liver damage. Therefore, it is important to carefully assess one's symptoms and consult a health professional when necessary.